menopause is making you moody and fatigued or even unhealthy, it could be a hormone deficiency with a simple solution, and that's good news. We've got Dr. Richard LeConey from the Institute of Anti-Aging. He's here to help, along with his patients, Nina Westerfield and her incredible mother, Nancy Westerfield. Nina, I'm telling you what, you've got good genes, because if your mom is 81 years old, oh my gosh, does she look fantastic? Well, now, Dr. LeConey, they're both your patients. Who saw you first?
Well, Nancy came to me first. Nancy had been had menopause a few years before, had been on the conventional hormone replacement plan, and she was having problems with it, so she decided to try out the bioidentical or natural hormones, and I think, as Nancy would tell you, she feels it did a lot for her.
Do you know, when I first started having symptoms, which was 20 years ago, I was on synthetic hormones because that's all
the way it was.
That's all they had to offer. So I was on Premarin all those years, and they left you on the hormone, you know, until after the menopause because it had so many benefits. The bone density was better and so forth. But after so long, I became concerned. And when I heard about bioidentical hormones as a replacement for what I was on, I went for it. And Dr. LeConey was the one that I went to at that time. So I have been with him for 8 years. I went to him when I was 73, and I started the hormone program that he has. And I can't tell you.
Well, what looking like she looks, what was that program, Dr. LeConey? Because I mean, you're just vibrant. You look fantastic.
Oh, thank you, thank you. I see others my age, and I have no incapacities. I go to the gym 3 days a week and work out with a trainer.
That's right there.
You know.
And then your daughter, now we were talking earlier, you were not experiencing symptoms of menopause, but you, obviously, because your mom did so well with Dr. LeConey, just thought you'd check it out on your own before menopause hits.
Exactly.
Because it's going to hit. It will. It will.
I saw the benefits that she was getting, and I never had any question in my mind that I would, you know, follow in her footsteps. So I went to see Dr. LeConey before I had any symptoms.
I think at the time, she still had her menstrual periods, and the time really the only thing that was bothering you was you were feeling sleep disturbance and tired, a little fatigued, things like that.
Did you wake flashes yet, like from perimenopause? Nothing?
Nothing.
Okay.
I was waking up during the night and having a difficult time going back to sleep, but that was it. And honestly, I didn't make the association at the time. But I went to see Dr. LeConey early because I thought it would be easier and better to maintain my levels rather than try to reverse any of the symptoms of going through, of losing hormones.
And Nina just got a simple bedtime dose of progesterone and
it worked wonders. I sleep fabulous. I have no problem sleeping now.
This is such a classic issue for women who are premenopausal, or perimenopausal is the kind of contemporary word. You know, they're still many years from actually having the menopause, but they have sleep disturbance.
Reading your information, 40 to 50, but you started at 61?
No, I started during my menopausal period, back in the early 50s. But then I did not go to Dr. LeConey and get on the bioidentical until I was 73.
Wasn't having the...
I still can't believe you're 81. God, you're so lucky to have a mom like that. Now tell us why most doctors don't do, or why a lot of doctors don't do this type of program that you do when you see the benefits are just so incredible.
Well, I think it has to do with the information available to physicians in training and later on. Certainly, you know, the major pharmaceutical companies are selling their, you know, conventional synthetic hormone replacement products. It's a big thing. So a lot of doctors really don't get any exposure to bioidentical hormones unless they just happen to, you know, go see a meeting or at a conference or something. So when I heard about it, I was very intrigued with it. And at that time, my wife, Dana, was having some kind of perimenopausal symptoms, kind of like Nina. And,
like what symptoms was she getting?
Well, again, you know, sleep disturbance, mood disturbance, feeling uneasy, having a little bit of the brain fog that has to do with poor sleep. A lot of the symptoms are a reflection of the poor sleep pattern that the 40-something-year-old woman who's definitely premenopausal experiences. So, you know, cognitive, you know, disturbance, you know, memory decline, fatigue, a little bit of, you know, decreased libido. Certainly the full-blown symptoms of menopause are years away. But there's perimenopausal symptoms, and again, they're just moody. Some people might say it's kind of like having PMS all the time.
And I'll tell you what, and it's sad for the husbands too, because these poor guys shaking their heads. Yes, yes, God bless us. These poor guys have to deal with us.
Absolutely.
And we can blame it on stress from work. The boss is obnoxious. The kids are misbehaving, and yet there might be a biological
little progesterone at night frequently is a major factor. And a lot of doctors will interpret those symptoms as depression and suggest that you try some antidepressants. And my suggestion there is try a little bedtime progesterone instead of an antidepressant at first, and see if that doesn't do the trick. Because if you're in that 40-something range, sometimes that's all you need.
Now, when we talk about hormones, I'm going through perimenopause. My mom is on hormone replacement. She's 71. Doesn't look like you did. I hope she's not watching. But why can't I just be? Why can't I just endure the symptoms myself?
Well, certainly you can. I mean, but in a sense, why do that if there's something better? If you can take a safe alternative.
Are there truly health benefits to this other than psychological?
I mean, there's 1,000 studies that will describe the benefits of hormone replacement. Certainly, it's still a little bit controversial, but as far as your